Okay, this is part 2 of chronic traumatic encephalopathy, basically brain damage and dementia due to chronic head trauma. Multiple repeated hits like from football, boxing, or other sources of repeated head trauma. Soccer is a terrible sport. Don't let your kid play soccer. That soccer mom idea is totally stupid. Soccer mom to me means stupid mom, because the kids are going to hit the ball with their head, and even if the parents tell them not to, when their friends are around, they're going to call them a chicken, and they're going to do it sooner or later. Plus, as they get older, I know some pee-wee leagues, they don't have the kids doing that, but sooner or later, they're going to be forced to do it. So I wouldn't let the kid play soccer. Okay, rugby will do it too. Ice hockey is head trauma. Any striking to the head. All right, so the stages of the disease, we already talked about this. It starts out in the sulcal crevice, the depth of the sulcus, the fundus of the sulcus, and eventually progresses to everywhere. And the best way to prevent it is just, don't do a sport with head trauma. Okay, it's pretty simple. All right, and the last one I told you, I think the best sport for a kid is tennis. All right, a couple things here. Here's just, my own drawing of it. So here's the crevice of the sulcus. So cortex means bark, like the bark of a tree, and that's the gray matter ribbon. It's the cell bodies of the neurons around the periphery of the brain. The depth of the sulcus, the fundus of the sulcus, the crevice of the sulcus, this is where it starts, because that's the spot with the most acceleration, deceleration, movement, and force vector during hits with football or any sport. The sulcal crevice, sulcal fundus. Okay, end stage CTE, chronic traumatic encephalopathy. It'll just outline the entire cortex, gray matter ribbon, and the temporal lobe and elsewhere. So it's a sad disaster. These guys end up demented. A lot of them, they die young. In their 40s, early 50s is pretty common. Okay, we show this. The pathognomic mnemonic lesion is, again, sulcal crevice, and then the tau. Tau is the name of a protein. Outlining, and there's plaques of them outlining a small vessel, so perivascular tauopathy. Okay, here's the big paper. This is sort of the paper that made the Boston group real famous. They wrote about NFL football players. Of the 111 NFL football players who donated their brains for autopsy, 110 of them were positive for chronic traumatic encephalopathy. So, of course, that's a biased sample set. They all thought they had something like this. They were all, demented, cognitively impaired, and they wanted to know what had happened. You can't effectively diagnose this with a brain MRI. You can only diagnose it when the patient is dead by autopsy. You could intuit the diagnosis and just say, hey, they had a lot of head trauma. They gradually, progressively became demented. That's CTE, and that's a reasonable thing to do. The NFL, of course, tried to downplay the damage, didn't want to admit it because it was afraid it would have to pay out a lot of money to the players. Plus, it's afraid that a lot of people will lose interest in football, won't want their kids to play football because of the head trauma issues. They also found lots of kids that only had played football in high school, and lots of guys who played it in college also had chronic traumatic encephalopathy. It's much, much, much more common than is widely recognized. Anything that causes head trauma repeatedly is going to put you at high risk for this disease. And then, like I said, the sad joke was most of the doctors, including the famous ones, taking care of these patients, like out in Boston and elsewhere, they recommend the Mediterranean diet, which is so stupid. It's like, open a book, you jerks. Look up just the basics. I mean, it's so pathetic. It's contemptible to hear a doctor recommending the Mediterranean diet. It's just like, do you have no respect, no self-respect? You can't open up a book and learn something? As soon as you hear somebody recommend the Mediterranean diet, they're phony. Okay, it's just automatic. An automatic, F on a nutrition test would be to say the Mediterranean diet's the best diet. Okay, so I just made up a real quick mnemonic of how you can remember what causes dementia. So I was sitting around writing down all the things that cause dementia, and then I just said, well, can I put this into an acronym, into a mnemonic? And it's pretty easy. I put the flames out. So D like that. Flames out, put out the fire of things causing dementia. And it's pretty straightforward. So I is for ischemia, all the things that cause that, including high-fat diets, of course. Infection, less common, herpes simplex virus, cold sores, will increase the risk a little bit. That's a relatively minor thing. There is such a thing as herpes simplex virus infection of the brain. That's super rare. To give you an idea of how rare that is, in the last 15 years, I've seen one case of HSV, herpes simplex virus of the brain. That's how rare it is. And I've seen many. I don't even know how many brains I've seen in the last 15 years. Hundreds of thousands. I don't even know how many Tons of them. So it's really, really rare. Okay, intoxication from alcohol. I've seen lots of pickled brains. Alcohol just shrinks the brain. It's a major neurotoxin. Immunoexcitotoxicity, a little more complex subject, but there's a lot of things that'll elevate the immune system, the microglia. I've lectured on that before. I'll talk about it more in the future, but excessive psychological stress. I got the stress over here, stress excess under S, sleep deprivation. Caffeine does the same thing as sleep deprivation, stress excess. They all increase catecholamines and cortisol. Okay, stimulants will do the same thing. They're going to cause dementia. A lot of them activate. Cocaine, methamphetamine, they will activate microglia and just cause chronic brain inflammation. Let's see, going back to the I put, so P is for psychiatric drugs. Psychiatric drugs are like a million times worse than the public realizes. As Bregan said, Grace Jackson, and many others, almost all of them cause a slow dementia, progressive lobotomy. Dr. Joseph is the best YouTube channel for talking about psychiatric drugs, but all the really good psychiatrists know this. It's no longer a secret. Uncontrolled hypertension. Hypertension is actually the most common cause of small vessel ischemic stroke, silent stroke on the brain. And we talked about how to beat the game on hypertension. I actually got a joke about hypertension. I'm going to save that for another video, but let me just tell you this. Hypertension is a disease that doesn't need to exist. Like Caldwell Esselstyn would say, just eat a low-fat diet without excessive dietary sodium, and your blood pressure is probably going to be pretty good. Once you've had it for decades and there's a lot of damage to the arteries or calcified, you'll never fully come back down to what you were as a youngster, but you'll improve a lot. Tobacco is just for idiots. You burn holes in your lung. Everybody says, well, I don't care if I die of lung cancer. Well, you're going to have a lot more problems than lung cancer. Your emphysema, destroying your lung tissue. It just burns holes in the lungs. Your lungs look like Swiss cheese. You're not going to be able to oxygenate effectively. You're going to end up on HOMO 2, walking around with a canister of oxygen. That's a pain in the ass. You don't want that. Okay, D for diabetes. And I told you, years ago, I asked my neurology friends, what's the most common cause of stroke in your clinical experience? And so one of them says hypertension, the other one says diabetes, the other one says atrial fibrillation. And I kind of laugh because those are all very common causes of stroke. They just cause different types of stroke. Hypertension causes the most common cause of periventricular silent strokes. And actually the most common cause of lacunar infarctions. Diabetes contributes a lot to small vessel microvasculopathy, blocking up the little tiny arteries in the brain like it blocks up the little tiny arteries in the foot, causes a lot of amputations. The diet, all these people, they're a bunch of stupid chumps. Mediterranean diet, sad diet, paleo, keto, carnivore, low carb. Mediterranean's got a little bit of things good for it. It does say avoid processed food, fast food, but still for chumps. Let's see, what else? Okay, then the flames out, like put the flames out. Falls. Old people fall all the time, and it's usually because they're cognitively impaired. So usually that's part of their downward spiral, a bunch of falls in the last year or two before they die. I cannot tell you how many times, like over 100,000, I've seen requisitions that say, old guy fell, hit head, old guy BHD, blunt head trauma, old guy fell on blood thinners. Okay, TBI, traumatic brain injury, PCS, post-concussion syndrome, CTE, chronic traumatic encephalopathy. All those things make a person stupid. Leaky gut means lack of dietary fiber or something else toxic to the gut lining. Then you get LPS, bacterial endotoxins, and LTA absorbed. They go up to the brain. You got an open blood-brain barrier if you got an open gut barrier. And then they'll activate the MG, meaning the microglia. And that is associated with brain inflammation, neuroinflammation, and eventual cognitive impairment. Amyloid clots, that's also from leaky guts. We talked about that before, the LPS and the LTA causing secondary protein structure to change from cylindrical, alpha helix, to beta pleated sheet, flat, stack up like a deck of cards. Amyloid clots, dense matted deposits. Douglas Kell, Atheresa Pretorius' work. They deserve a Nobel Prize. They'll never get one because they don't want the public to know about this. AGEs, advanced glycation end products. There's a lot of that in high-fat foods and in high-protein foods. Another reason to avoid all the meat business, and also why I avoid nuts. They're high in the AGEs as well. Alcohol, like I said, I kind of just threw it in there 2 places. Mitochondrial inhibitors, I've given a bunch of lectures on that. Because you need to make a lot of ATP in the brain just to function, but also to pump out all the toxins. Brain cells are pretty good at defending themselves if they've got energy. So you don't want to be ingesting all these mitochondrial inhibitors. Like I said, I give them lectures on it. There's over 60 of them that are common. Okay, marijuana. Marijuana's for chumps. You don't want to be doing that. Don't let anybody tell you otherwise. I've seen lots of people with serious brain damage from marijuana, and it's a gateway drug to becoming a bigger idiot and a drug addict. It often leads to the marijuana being laced with PCP and them having psychotic breaks, or even if it's not, they can have a psychotic breakdown. Then when they go for a psychotic breakdown, the stupid psychiatrist puts them on antipsychotics and can potentially give them a chemical lobotomy, like that recent lady interviewed on Dr. Joseph. E for estrogenics. Estrogenics used to be called EDCs, endocrine disrupting chemicals, but now they call them, based on the work of Gil Cirolini, the brilliant researcher, he said, you should call them ENDCs because they routinely, 80% of them are neurologic disruptors. They're toxic to your central nervous system. Not good. They're also often toxic. At least 20% of them are toxic to the thyroid, so you don't want to mess up your thyroid. Okay, EMF, electromotive force, and that's all the things like Wi-Fi and cell phones. That's all bad for the brain. You want to use a speakerphone. Don't hold it next to your ear. S, sleep deprivation, like we talked about, that stress, excess, stimulants. I also put in here social support, purpose and religion. A person who's got some good social support, at least one friend or family member they're close with, having a sense of purpose makes you much stronger. Like I said, like Maxwell Maltz talked about the self-image. If he'd have a lady who needed a surgery, but then she wanted to get home to her kids, man, she would get out of that surgery, she would recover, she'd go home to her kids. Okay, but if you have some lady who's just a confused nut job and she wants a surgery for cosmetic reasons and she's confused and all this stuff about what she really wants, she'll often sit around in the hospital for a long time and have a bad outcome. So you got to have a strong sense of purpose. Like I said, the real smart doctors I've known, when they go for surgery, they sign out AMA the first day and go home. They say, I don't want to be sitting around the hospital. I'm fine. I can handle the pain. That's what my smart doctors do friends do when they have surgery. Okay. Religion. Religious people are far healthier. I should also put in here S for sedentary. You don't want to be sedentary. It makes you stupid, and your immune system doesn't work as well. You got to do some exercise. We're built to exercise a lot. At least do some walking every day. O for oils, omega-6 especially, obesity, oxidative stress. I don't think omega-3s protect the brain. I gave a separate lecture on that recently. I think I said our omega-3 is a joke. Oxidative stress, but there's a lot of things called oxidative stress. I just sort of threw it in there. Opioids, too, are really bad. Don't ever take opioids, okay? Whatever they tell you is BS. And the longer you're on them, the worse they get. You get addicted. They start having... start doing the opposite. They can increase your pain after a while. They're not a good long-term drug. UPFs, ultra-processed foods, all that MSG, MFG, that stuff is neurotoxic. Food additives, aspartame, the dyes, the mold inhibitors, mitochondrial inhibitors, it's all bad. You don't want to eat processed food. I won't eat anything with more than one ingredient, only one ingredient, because they're allowed to put other things in the second ingredient that can make you sick. T for toxins, aluminum, lead, mercury, cadmium, iron, VOCs, volatile organic chemicals, all that stuff that transitions. Like I would never, let's say you're a woman, I would never go to one of those nail salons and smell all that crap. That's not good for your brain. Cleaning chemicals, not good for your brain. Diesel exhaust, there's a whole bunch of other things. Anything that smells bad is bad for you. So anyways, this is a real quick way you can remember all this stuff. You say, I put the flames out, okay, and then you can real quick remember them all. And I see these things all the time when I was in school, and they help, these acronyms. But I'm just showing you, it's pretty easy. You can avoid everything on this list, and your risk of being demented or cognitively impaired dramatically drops. And like I'm saying too, all these docs all over the place don't know this. To me, this is like kind of basic and obvious, but they don't know this. They have no clue about all this. They know tobacco's bad and alcohol's bad. They don't realize how bad psychiatric drugs are. Psychiatric drugs are an absolute disaster. They don't know about the food, the oils. They're not allowed to talk about religion and all this stuff and more openly about these other things. They don't know about the amyloid clots, the advanced glycation, etc. They don't know about leaky gut, LPS, all this stuff. Anyways, I hope that was helpful.